We are back. It is just about 20 minutes after 11 a.m. right here on WOCA in Ocala. And we are talking to somebody that is on the other side of the coast. He's getting up just in time to talk with us. We are talking with Dr. John Mendelson. He is an MD and the medical director of RIA Health. Good morning, John. How are you, sir?
I'm fine. How are you?
Doing good. We talked off the air just a little bit. John's over in San Francisco where the weather is pretty much like it is here. So we're enjoying the day. It's going to be a nice Thanksgiving holiday. But as with every holiday, there are some little demons that could possibly come out. And what we're here talking about today is actually alcohol, drinking alcohol and the disorder of alcohol.
Yes. Yes. So we're talking about problem alcohol consumption and people who have, and what we can do about it. And we formed a company that incorporates most of the evidence that has been accumulated over the last 20 years through scientists, clinical researchers, and basic scientists on alcohol abuse and alcoholism. And most people don't know it, but this is actually a surprisingly treatable disorder, and one you can get a lot of benefit from treatment in decreasing and controlling your drinking. You don't have to just quit. We offer a way for people to cut down their drinking as well. But perhaps if you want, we can talk about questions or what issues do you have that you'd like to learn about?
Well, we have the holidays coming up here, and so many people overdo it, and they just get a little over their head. And you hear about Uncle Bob, and the research shows that the uncles are the most likely. That's why we always say uncle, but they just get a little too over their head. The holidays come around. Sometimes it's just a stressful time. What are some tips and cues we can try to incorporate in our lives to maybe slow that down a little bit?
Well, first off, everyone should know some of the definitions of excessive drinking. If you drink more than 4 standard drinks on an occasion, that's sort of your maximum. You get up to 5, you're into the binge and high intensity drinking territory. So 5 standard drinks over 2 hours would equal a high intensity drinking episode. And your blood alcohol level, if you do that, will almost always be above 0.08. Okay? So that's the legal limit for driving in the United States. So first off, don't go to that point, right? Don't, pace your drinks, drink them further apart, have smaller drinks, drink beverages with lower alcohol contents. Some people don't realize this, but beers vary in alcohol content from about 4% to about 12%. And wine varies also from 12% to about 16% of alcohol content. That means that if you're drinking a high alcohol content wine, you're actually drinking a lot more alcohol per glass. And so knowing that makes a difference. The mixed drinks, many mixed drinks actually contain 2 or 3 standard drinks in a single glass.
Wow.
And so if you want to drink less, tell the bartender to give you less alcohol, right?
Yeah.
And at the price you're really paying for the ambiance and the rest of the drink rather than the alcohol. So I think cutting down is not as hard as people think it is if you just take a few simple steps and do it.
Yeah, you're right, because the ambiance is part of the whole experience. So you relax, you're having things with friends. You don't want to be odd man out.
Exactly. Over the holidays too, oftentimes people realize that they have a drinking problem, and that comes up when they lose control in front of their friends or family members. We have a lot of people who come to treatment because they've alienated a friend or a close family member or a friend by saying things they shouldn't say while drinking, and or by picking a fight they didn't want to pick, or not remembering that they said certain things that were taboo within that family structure or hurtful. So if you're engaging in behaviors where you're either not able to control your behavior or say things you don't want to say or can't even remember what happened, you can merit some treatment. I think one of the big things is that people don't have to hit bottom to get help and to get treatment.
That's a good statement. I like that. Yeah.
And that's sort of been the model over the years, that you have to like if you alienate all your friends and lose your job and you're living on the street, that's when you qualify for treatment. And the treatment is always some kind of spiritual treatment. You have to go and join a group and somehow like cleanse your soul. Those things are good. Cleansing your soul is good. Spirituality is great.
I like that.
But you don't got to do it. You don't got to do it to get better. Okay, there are things you can do in addition.
It seems like this is a more logical approach to the situation and to a problem that doesn't have to get to such an extent. Like you said, it's a logical approach to stop it from getting to that point.
Yes, and I think I like the term medical approach better because, we're not in medicine. One of the things we train our students, medical students, and I was trained in is you really don't want to be judgmental. Someone comes with a problem. You want to find the best solution to it that doesn't impugn the value of that person and what their beliefs are. We all do stupid things. I'm a big bike rider, and at some point I'll fall off my bicycle and break something. And the last thing I need is some guy in the emergency room telling me I'm an idiot.
Mm-hmm.
Right?
Yeah.
He or she may be right, but that doesn't mean that I need to know that
there's nothing you need to hear at the moment. Yeah, it's not very productive.
Yeah, exactly. It doesn't set my bones, and it doesn't fix anything at all.
Yeah.
Well, addictions are really stigmatized. People have a really negative view of addiction and really think it's about the person, not about the disease. But as most people who have alcohol abuse and alcohol use disorder and alcoholism will tell you, they didn't get there by choice. They got there through a series of increments that left them out of control of their drinking and terrified.
Right.
I think that's the other big thing. If you're drinking and you're terrified, you're scared of what happens to you when you drink. That's a really good reason to go get some help.
Yeah, absolutely.
Do something different.
Well, you've got in here, I'm just reading over some of your statements, and the economy, I didn't even think about this. Touch on that a minute, if you would.
Well, the economy's complicated in the sense that people tend to actually drink more as the economy gets better. So one of the things that most people who have an alcohol problem, at one point in their life, were drinking in a controlled manner. Okay, and for many of our patients, they've been drinking and have had 20 years of controlled drinking.
Yeah.
So what sets them off? What changes in them that now goes from controlled to uncontrolled drinking? Well, one of the big precipitants is stress. And when I say stress, I don't. Everyone has their own definition of stress, but this is something that really gets under people's skin. It can be loss of a job, it can be loss of a relative, a death of a relative who was very close. So stressors, big stressors, can cause the transition from controlled to uncontrolled drinking, and economic stress is one of those. So like with the recession in 2008, a lot of people lost their jobs. They both they felt bad about themselves. They had less money and less resources, and they had more time. And that combination, if you're already drinking moderately or even heavily, can lead to a transition from controlled to uncontrolled drinking. However, the other side of that coin is that in good economic times, people also drink more because they have more money.
Yeah.
Right? More resources. And so we can see increases in alcohol use in good economic times because people have more leisure time. Today, one of the more interesting things, some recent studies show that over the decade from 2002 to 2012, which included the Great Recession, the rate of alcohol use disorder climbed substantially in the United States. And not a little bit, like about 10%.
Oh, wow.
The increases were most pronounced in women, where there was an 84% increase in the rate of disease, and in the elderly, where there was about a 60% increase in the rate of disease. So some people think, I'm retired, I can have my wine starting at noon, and there's no problem with it. We take care of a lot of patients who are in their 60s, 70s, and 80s who had a prior drinking history that was not terrible.
Yeah.
And now they're out. They're drinking 2 bottles of wine a day.
Oh.
Having blackouts, having falls, and if they're not having those, they know where they're going.
Yeah.
They know the path. So I know Florida's got a lot of retirees. So if you're a retiree and your alcohol consumption has increased dramatically, you should look out for people like us. We're there. But they'd be to help. That is, they're not there to do something bad.
Well, clearly, yeah.
So the rates of alcohol use disorder have climbed in the United States during the recession period.
Mm-hmm.
Some of that, but if you look worldwide, again, about 1 in 10 people in the world have some form of problematic drinking, either binge drinking, drinking again more than 4 to 5 drinks per drinking occasion at least once a week.
Yeah.
Or high intensity drinker drinking definitely more than 5 drinks per occasion, or daily consumption that's well above the accepted health safety points. So it's a really prevalent problem. So is there some good news here, right? Is there some good news here? Well, one of the good pieces of good news is that if you get treated, or and some people spontaneously get better, which is kind of against the dogma of the field that you're never once you're an addict, you're always an addict. Your best you can do is be in recovery, and try to avoid relapsing. If your drinking does, studies, the epidemiologic evidence shows that people who've gotten treated and then, go out 5 years, many of them are drinking again, but at much lower levels. So,
wow.
so a return to controlled drinking is possible for many people. But they have to address it. They have to have a period of time of treatment in order to get there, or just
get away from that stigma of it's got to be all or nothing, because that's a pretty big stigma in our society. I'm a recovering alcoholic, so I can't have a single drop, or I will just go off the wagon. But you're saying, and logically so, that no, there's a better way. There is a more medically, scientifically proven way that says we can do this in a much more controlled atmosphere.
Yeah. Some people may require sober intervals, periods of time for sobriety, but many people, depending on their consumption patterns and their biology, we can bring them down to controlled drinking fairly quickly, and without. I think the stigma is another thing that's always worth talking about. We use words like in the addiction field, people use words like you're clean or you're dirty, right?
Yeah.
If you give me a dirty urine test, if you've got a dirty urine, you're a dirty person too. And I don't think you can get much more stigmatized than that.
Yeah.
You relapse, but if you're relapsing, that means you must have been lapsed to begin with.
Exactly.
Right?
Yep.
And so, yeah. So you're just going back to your native state of lapse. We have one pejorative term after another in addiction that basically demeans the person, the individual person, and builds shame and stigma.
And we just don't need that. That's like you said, it's unnecessary.
Exactly. I don't know anything where really shaming people really has worked really well. I mean, if it did, we'd bring back the public stocks, in the scarlet letters, and
Oh yeah.
Shame really.
Who doesn't love a public stock? I mean, come on.
Yeah, exactly. a good public humiliation.
Floggings.
Floggings. Exactly. I'm sure Disney will put together a theme ride.
Oh yeah, yeah. Well, we've got the Shrek ride. We'll do that. The flogging ride from Shrek. We'll just bring it back.
That'd be good.
Oh, John. Well, sir, we appreciate all your information. Now, is there a great website to go to?
Yeah. People can go to www.RIA Health, HEALTH.com. It's all one word, RIAHealth.com. And my background, I'm an internist, and I'm also a research scientist. So I've been doing clinical trials in addiction for a good 30 years, all funded by the NIH. So again, our approach really grows out of the science base that's been developed at the National Institutes of Health, and particularly the National Institutes of Alcoholism and Alcohol Abuse. Mm-hmm. By nation's top scientists, many of whom actually are in Florida. So there's a lot of great clinical and research scientists in Florida working on both opiates and alcohol that do really interesting things.
Yeah.
So, but yeah, go to RIA Health, and if people have questions, we actually have a free. We can, if people have questions about themselves or their family members, and believe me, a lot of people are going to have. There are going to be a lot of experiences on Thursday where family members
Yeah.
concerned about someone drinking. We do free consultations, and we're available if necessary.
Well, it's a great service. It's a great product, John. It's a huge epidemic, and it's great to see that there's something else out there besides just the one thing. That there are alternative methods to getting to the bottom of the problem. And we really appreciate you being on air. And come back anytime, sir.
My pleasure. Thanks so much for having me.
All right. Thank you, guys. Dr. John, let me make sure I don't butcher your last name. Mendelson, MD, Director. Thank you, sir, of RIA Health. Just visit riahealth.com. All right, we'll take a little break and we'll be right back.